But first, the number of states where recreational pot is now legal is growing. It's up to 10 states and the District of Columbia. Many users are consuming marijuana edibles instead of smoking the leaf. But the research on the effects of edibles is scarce. From Rocky Mountain PBS in Denver, Lori Jane Gliha explores the potential link between marijuana edibles and psychosis.
A man accused of murdering his wife while she was on the phone calling 911.
She said her husband was hallucinating and was scaring their 3 small children.
In April 2014, Richard Kirk did the unthinkable. The father of 3 opened his family's safe, retrieved his gun, and shot his wife in the head.
Stuff like
Who
that
else is
works.
interested in the truth? You only.
Me. It's you and me right here.
So far, nobody's been interested in the truth.
This footage from questioning at the police station shows a confused Kirk not long after he pulled the trigger.
If you can't afford a lawyer, one will be appointed for you without cost to you before questioning. Do you understand each of these rights that I've read to you?
I was kind of spaced out.
You want to go over them? We'll go over them again.
Yes. Please.
All right.
He blamed the murder on a marijuana-infused edible gummy, which at the time was newly legalized for recreational consumption in Colorado.
That was the worst decision I ever made in my life.
This is the first interview Kirk has given. The prison wouldn't permit video cameras inside, but we were allowed to record audio.
I know without any doubt that if I did not eat that marijuana, my wife and family would still be together today. I know that with a certainty.
It is the first time since the murder in 2014 that he's spoken publicly. And despite a history of marital troubles, financial issues, and allegations he had a short temper, he still insists the marijuana edible made him do it.
I didn't know it was my wife. I thought it was somebody else, I guess. That's the only way I could have done it. I never ever once thought about even hurting my wife or pushing her or anything.
Whether you believe his story or not, Colorado regulators did make significant changes after that incident by restricting serving sizes, limiting the psychoactive ingredient THC in each serving to 10 milligrams, with no more than 100 milligrams in a single package. And one marijuana researcher says he has new evidence linking edibles to psychiatric complications in the emergency room.
There seemed to be a disproportionate number of visits associated with edible cannabis products compared to other products.
Dr. Andrew Monti sits on Colorado's Retail Marijuana Public Health Advisory Committee and has been researching cannabis since 2009. He also worked as a paid consultant for Kirk's defense team.
Not everybody that takes an edible agent is going to have hallucinations. Many people do take it and take it safely, and so we need to understand and respect that.
In his latest research, which is now undergoing a peer review, Monti tracked the 2,600 marijuana attributable patient visits to the emergency department at UC Health University of Colorado Hospital over the last 5 years. The number of emergency patients with marijuana-related symptoms who visited the hospital made up less than 1% of all visitors to the ER. But Monti found of those, medical events like hallucinations occurred at a greater rate for edible users when compared with patients who smoked the drug.
Clearly, edibles seem to have a more severe toxicity than inhaled agents, and it seems that much of this is actually psychiatric in nature.
While Dr. Monti warns of the unpredictability of edibles, little research has been done on their effects. Pot proponents say consumers have been empowered to use them responsibly for years, with few problems.
It's more about the education. Start low and go slow. I'll even advise people if they're really unsure to cut one of those in half.
Brian Nowak is the general manager at the Simply Pure dispensary in Denver, Colorado.
I understand the caution. I just think that now we need to really focus on the research and education so that we can start basing things off of facts and science rather than just this, being scared of a new industry.
There is no consistent method for tracking violent incidents linked to edibles. Our reporting found only a handful of cases across the country since 2014 that were so violent they made the news. A brief search of Denver 911 logs over a 4-year period shows at least 91 documented reports of edible-related calls, incidents ranging from mild hallucinations to violent reactions.
With very few, 1 or 2 people of negative cases out of how many millions of people use cannabis every single day and have for the last 50 years. I mean, basing things off of very few instances is where I'm having the bigger issue.
I think that the best thing that we did was limit what was the maximum dosage that could go into any one edible product.
Dr. Carrie Franzen is an associate professor of clinical pharmacy at the University of Colorado who helped draft the state's marijuana regulations.
With edibles, there's a delay in getting the drug into the system because it has to be swallowed, it has to be broken up in the gastrointestinal tract, and it has to be absorbed. That can take anywhere from 30 minutes to a few hours, and how much gets in can vary depending on what somebody ate that day, if they're on another drug, if they just exercised that day, how much fluid they have in their system. There's a lot of different factors.
Meanwhile, the push for marijuana legalization is growing. Oregon and Alaska have the most restrictive edible serving sizes at 5 milligrams of THC in each. And dozens of others are considering or implementing new marijuana regulations, many looking to Colorado for guidance.
I'd say we've been really diligent in identifying issues and responding to them quickly.
Colorado's marijuana coordinator Dominique Mendiola says the state is frequently updating its rules to reflect the changing market. In 2018, the state addressed an increasing number of children accessing marijuana by preventing manufacturers from making edibles that look like tempting fruit or animal shapes. And required testing of edibles now checks for consistency and potency. It may never be clear exactly how the marijuana edible affected Richard Kirk on the night he murdered his wife, Chris.
I think a lot of people are affected by the deep sorrow that people feel about what happened. I hope that they think about Chris and they think about the people that are making the laws. I would hope that Chris's memory would stay in the forefront.
As more states consider legalizing recreational marijuana, the research into the effects of edible marijuana will only become more important. For the PBS NewsHour, I'm Lori Jangliha in Denver, Colorado.